Okay, we're going to talk a little bit about the neurotransmitters that are used by the autonomic efferent system. Autonomic neurons secrete 3 different types of neurotransmitters, all of these which we briefly touched on in Chapter 3, acetylcholine, norepinephrine, and epinephrine. And we're not going to worry about whether things are cholinergic or androgenic. The autonomic neurons that secrete acetylcholine are the preganglionic neurons in the whole autonomic nervous system, and the postganglionic neurons of the parasympathetic system. The norepinephrine and epinephrine, they're secreted by the postganglionic neurons of the sympathetic nervous system, and we will talk more about that. So just like in the rest of the body, the effects of the neurotransmitter depend on the type of receptor that is activated by the neurotransmitter. So, acetylcholine, it also functions at the neuromuscular junction. When it is received on those receptors on the muscle cell at the neuromuscular junction, it produces an excitatory postsynaptic potential, and it causes the muscle to contract. In the autonomic nervous system, it will have some different effects. Okay, so there's kind of an interesting thing in the PowerPoint about nicotine. You won't be tested on it, but if you want to read it, it's kind of interesting. Nicotine is a cholinergic receptor, an acetylcholine receptor, and it's a stimulant, as you can imagine. It has actions in the limbic system that induces feelings of alertness and arousal, and those are the things that lead to nicotine addiction. So pretty interesting. So norepinephrine and epinephrine are secreted by the adrenal medulla. The adrenal gland sits on top of the kidneys. It's an endocrine gland, and it releases epinephrine and norepinephrine directly into the blood. So its effects on the autonomic nervous system are widespread because it's released into the bloodstream. Okay. So just looking a little bit at the arrangement of the 2 areas of the nervous system, sympathetic and parasympathetic. The sympathetic efferents, they have the preganglionic neuron, which is coming down mostly through the thoracic and cervical areas, so it's frequently called the cervicothoracic outflow. It synapses with in a ganglion right near the vertebra, so they call them paravertebral ganglia, with the postsynaptic neuron, which then goes out to the effector organ. All of the sympathetic ganglia are in a row. They all get activated together, and that has a lot to do with how quickly the sympathetic system kicks in, and we'll talk more about that. But it's cervicothoracic in that area, and they all are in a row, and they act quickly. The parasympathetic system, on the other hand, the ganglia are, I don't have the right picture in here. The ganglia are not all in a row. The ganglia are close to or actually inside the effector organ. So because they're more widespread, they don't all act together, and the effect of the parasympathetic nervous system is slow. Okay, so we will talk a little bit more about that. So the afferent pathways, they also have the nociceptive afferents in particular have connections in the spinal cord, in the dorsal horn of the spinal cord, with somatic afferents. So a lot of times when that's where we get the phenomenon of referred pain that we talked about in Chapter 7. A lot of those visceral afferents, they are conveying information, so you get you might have something going wrong in one of the organs, and you get the feeling of pain in another area of the body. For example, you're having a heart attack and you feel pain going down your left arm. That is that referred pain that we were talking about, and it's because of the connections in the dorsal horn of the spinal cord between visceral nociceptive afferents and somatic afferents. Okay. So we will talk in the next section about the sympathetic and parasympathetic nervous systems and the differences between the 2 systems.